The Spirit of GRAAM, an interview with founder Dr. Balu.
What have been the most impactful milestones?
I would actually look back, and it's a great question. I've never looked back, so I'm going to look back now. I would say there were a few milestones. The first milestone for me was selling this idea. Selling this idea to friends and classmates in the development space at Harvard, selling this idea to a few professors and thinkers at the Kennedy School, selling this idea to friends who would believe in me in India, putting the team together. So that is when I really felt maybe it's an idea which can be explored. So that would have been the first milestone, because all of us have a lot of bright ideas, but to convince others, to take them along and actually test it out. The second milestone was actually trying to convince government that people's voices matter. Now, we always believe, we all use these words democracy in action, people-centric processes, but in reality, few powerful forces decide policy. I think policy around the world is already captured by very powerful allied forces. And in this narrative, to change it and to get them to accept that people's voices matter was my second milestone. Then more specifically on the projects, a project which I truly enjoyed and inspired me a lot was to look at how do you actually get communities to measure and monitor their own programs which impacts them. So we had a program called Arogya Shreni, which essentially meant how do you measure the performance of primary health centers in the district of Mysore, the public health centers of government, and how does community perception actually help rank these primary health centers and their performance. So we normally believe the poor, the disadvantaged, the users of public services are not really capable of actually evaluating and measuring performance of these services. There's this mistaken impression that users cannot monitor performance, and we demolished that myth and we combined technology. We realized that virtually every person in an Indian village is likely to have a cell phone, and so we said, can we use the power of a cell phone, a very ordinary cell phone, take it beyond just using it as a telephonic instrument. And these are days when smartphones were not the norm. Very ordinary small little bricks were the norm. And we got ordinary men and women at the community level using technology of the IVRS systems, interactive voice response systems, and cell phones to rank it. And it became so popular and so good, and the error margins fell to below less than 3%, that what communities looked at the performance of their primary health centers was as close to reality as you can get. And this became an excellent feedback loop to the government. And we saw public health services improving. So the power of this technology-enabled governance intervention to me was so exciting that I realized that we could actually take this to any public service. It could be running your local school, it could be running your local public distribution systems, food distribution processes, or your local child welfare centers. And so to me, that's a very powerful experiment that we ran. And it also gave me faith that ordinary people can do extraordinary things. The second program which gave me faith that governments are also serious about change. There's the mistaken notion that governments are big monsters out there. They are behemoths which don't respond. They're big elephants which can't change direction. I personally, with my more than 3 decades of engaging with government, don't agree. I believe there are a lot of good people in the government systems who really want to improve things, to bring change, who are concerned about the last mile problem that countries like India face, and they're looking for inputs. And we actually evaluated a very large scale state level health project called the National Health Rural Mission and how it impacts state. And we asked 3 fundamental questions. Is money being spent on people? Is that going to have an impact on health outcomes? People providing services. It could be right from a grassroots level worker to a doctor. Or is money spent on actual specific health intervention programs? Is that getting better outcomes? Or is typically in situations like India and developing countries, there's always a nexus between the politician, bureaucrat and the local contractors who will try to capture away all the money into putting up big buildings, because that's where the money lies. And people believe putting up big buildings actually provides healthcare. It's like you build a hospital, people will be healthy. It doesn't work that way. So we wanted to understand, is money spent on infrastructure going to result in health outcomes? And the study we did, and fascinating results came out, and we actually had the health secretary of the state spend a whole day sitting with us and discussing, and then going and transacting in a real environment and implementing these changes. So that was very reassuring to me that there are good people in the system who actually want inputs to change, and if you give them the evidence, they're willing to change. So I would say these are 2 projects, and We have been now working with looking at public service system in terms of the health workers and how do you empower her in the northern parts of the state. We're now working with corporates and looking at if we can engage with corporate, educate them, and actually demonstrate models to them, they will be more willing to imitate. And so every one of these, in a sense, is very reassuring to me, and it sort of reaffirmed that institutions like GRAAM are an absolute necessity, and there's a great future.
To learn more, visit www.graam.org.in.